Hi everyone, I'm Dr. Hooi Ling. I'm the psychiatrist from Hospital Sibu. Thank you Pustaka Negeri Sarawak for inviting me to deliver a talk on women mental health. Mental health issue can occur in both gender, both male and female. But why women mental health matters? Right? Gender can actually play a role in the manifestation of the mental health issue. For example, certain mental disorders are more commonly seen in women compared to men, like depression, anxiety, eating disorder, some suicidal behaviors, or deliberate self-harm. So why? We can categorize it into a few factors. The first one, biological factor. Biological factor, the changes within the body of female or the hormonal changes throughout the reproductive sexual life. Because as we know, women, we actually progress through a different life stages. From birth to puberty, that's the first stage. And then the puberty, adolescence, right, to the adulthood. And then after that is the womanhood. The womanhood where they go through the pregnancy as well as the perimenopausal stage, right? So different stages of the reproductive life, will have a hormonal changes, and these hormonal changes actually played a role in the development of this mental illness. All right. The second factor is the psychological factor, or we can say the personality of the individual. For example, is how a woman cope with their stress, how they manage stress, how they manage the emotion. As we know, women tend to internalize their feeling rather than externalize. Like men, they always externalize it. That's why they end up with some substance abuse, destructive behavior. But for women, tend to internalize their feeling, meaning that they hide their feeling, confide to themselves. So when they cannot take it, they don't know how to manage their emotion, they felt overwhelmed. That's when they resort to self-harm. Alright, this is the psychological or the personality. And then the third factor is the social cultural background. Alright, as we know, in some family, they still believe in the male dominant world. That's why throughout their adolescent years, or when they grow up, the lady, they might receive some form of rejection from the family, for example, right? Or they might receive some discrimination, rejection, some unfair judgment from the family. So in that kind of unsupportive family environment, they might grow up being low self-esteem, they have lack of confidence about themselves. They become more sensitive towards other people's comment towards them. So they become the pleaser, people pleaser. They want to please others, they prioritize others rather than themselves. So all these factors actually can predispose the woman, the individual, to develop a depression, for example, compared to other people who has a stronger, better coping skill, right? So just now we mentioned, so this roughly we divide it into 3 different stages, right? So we mentioned women go through different life stages, right? So the first one, from birth to puberty. The puberty is said to be a key turning point for a woman. Why? Because study has shown that prior to puberty, the chances of boys and girls getting depression actually is the same. But after puberty, the chances of a girl develop depression actually is 2 times higher. Some studies say 4 times, but generally we say 2 times higher compared to men. In the following life after puberty. So puberty is the one turning point. Then after that, during their development, because of the biased environment, they might be discriminated, so they might grown up, just now we mentioned about low self-esteem, they might internalize their feeling, they have poor coping skills, also they might be exposed to abuse. When we talk about abuse, it's not only about physical abuse. Often we neglect about emotional abuse and also sexual abuse, right? So women has higher chance of becoming a victim of sexual abuse compared to a man. Okay, and what is the unfortunate thing is when the victim explain to, or maybe they try to seek help from their family members, okay, about the sexual abuse, they are being dismissed, okay, or because the family members don't trust them, because usually very often we see that the perpetrator of sexual abuse is actually the close family members. All right, so when the victim being dismissed, okay, or being scolded for accusing someone for being the perpetrator of the sexual abuse, so that caused another harm for themselves. All right, so all these factors actually predispose, or we say that added higher risk for a lady to develop some depressive symptoms, anxiety symptoms, to become more and more traumatized after the incident, right? All right, okay, so after puberty, from the adolescent years, they grown up, okay, to become into the womanhood, right? So they go through, maybe they will start engage in some relationship, and then they go into marriage, right? Marriage, then they get pregnant, okay? Pregnancy is another risk for a woman to increase their chance of getting mental health issues if they don't get enough support from the family, right? Okay, so very often we've seen that during the peripartum, meaning that is during pregnancy and after pregnancy, right after pregnancy, that period is called the peripartum period. Okay, so that time, if they don't get enough support, and on top of any other reasons, right, that predispose them to develop a depression, anxiety, or even psychosis. Okay, pregnancy itself. Later on, they slowly grow, childcare, work, yeah, and after that finally becomes, there reaches the menopausal period. Okay, perimenopausal period. Perimenopausal referring to the period before and also during the menopausal period, right? That itself is another life stage for a woman. Okay, so the hormonal changes during that time, can cause some emotional changes. For example, the perimenopausal women might develop some mood swing. They might have some anxiety symptom, yeah, irritability, and then the depressive symptoms during that time. Yeah, that's what we call the perimenopausal depression. Okay, so different life stages, all this predispose the woman to develop the mental illness compared to a man, right? Okay, so we mentioned about all this, but remember in 2019, that's when the COVID-19 pandemic hit. So during the pandemic, the movement control order was ordered, right? So everyone was being locked down, isolated at home. So during that time, especially the working mother, the professional working lady, they have to balance themselves between multiple roles. Okay, even before the pandemic itself, when they slowly grow up, right, from a daughter of someone, they becoming a working lady, they're responsible for themselves, and then later on when they get into marriage, right, they are the wife, they are the daughter-in-law, and when they have children, they becoming the mother. So a woman throughout their lifetime, they has been trying to manage and balance between the multiple roles, right? So after the pandemic itself, right, that pandemic actually has a negative impact on the mental health of women, especially. Why? During that time, even though during lockdown, but some working mother, yeah, they are still continue to work, right? So not only that, they have to handle their work, they have to handle the house chores, they have to handle the childcare, right? And when the school reopened, but when, let's say, some case detected in the nursery, right, and the nursery or the daycare center being closed down, so they have to take care of the homeschooling as well. So multiple roles. This is one of the reason that predisposed to an increasing trend of the mental health issues during women during the pandemic. Another reason is what we observed was the incidence of domestic abuse, right? Substance abuse, domestic violence actually increased during the pandemic period. Okay, so all these risks even added more stress to the woman to develop mental illness. Okay, so we talk about why are they no more prone to develop mental illness if they don't have a strong mental power or the resilience, what we call the ability to adapt to the adversity, right? If they don't have a good coping skills, right? So how do we protect ourselves from all this? How do we identify? Early identification of the signs and symptoms of mental illness is very important, right? When we talk about the commonly seen disorders among women, right? For example, depression, anxiety. Yeah. So what are those signs and symptoms? When something occurs, that's what we call the stressor. Someone might feel, they might have a lot of worrying thoughts, okay, about over some issues. Okay, so when something happened, then they stress about it, then they have more and more worrying thoughts. Their mood started to become low. Then low mood, and then the low mood become more and more persistent. They started to have the sleep disturbances, right? The sleep disturbances, either it can be they sleep more or they have difficulty in falling asleep or frequent awakening. They don't feel refreshed even after rested, right? So other than sleep, appetite also have some changes, right? Either they eat more or they eat less. They don't have appetite. Okay, then how about the energy, right? Someone, when they have lack of sleep, the next day they felt very tired, they felt irritable, they felt that the emotions are unstable. So they, during work or class or doing something, they couldn't concentrate. They need more and more mental energy to do something, to complete the task, right? Longer time to complete the task. So there is some impact on the functioning, daily functioning. Okay, so when they get more and more frustrated, and then they started to have more and more negative thoughts about themselves. Okay, they started to feel useless. They felt helpless. Even they felt worthless to some extent, right? So that's when they started to have the suicidal thought. Some people, they might have they started to self-harm. Okay, or some even have suicidal thought. They started planning, and then some even attempted suicide, right? So they end up in a severe depression because of a suicidal attempt. Then they end up in a hospital, right? So other than depression, anxiety also is very common among women compared to men, right? Anxiety, when we talk about anxiety, when something happens, some people, yes, definitely worry is normal, right? But when it becomes excessive worrying, okay, excessive worry which is uncontrollable, they cannot control, they keep on thinking, keep on worrying about trivial things, small issues also they get worried, which is excessive and not reasonable. Okay, so when they become more and more worried, they tend to get more irritable as well. They always felt on edge. They felt restless, they couldn't sit still, always worrying about something, right? Then they also have some difficulty in concentrating. They have some sleep disturbances, right? Muscle tension, or because always very tense, very anxious. Okay, so this is what we call the generalized anxiety disorder, right? On top of that, some people can have a panic attack, right? So panic attack, when they have some episodes of following symptoms. For example, very commonly they complain of sudden onset of breathlessness. They felt very difficult to breathe. Other than breathlessness, then they might feel their heart pounding very fast. Okay, heart pounding fast. They might have tremor, means the hand is shaking, right? Hand tremor. They felt nauseous, and then they have some they say gastric pain, gastric discomfort, dizziness. Some people might have some tingling, numbness sensation over their hand and feet. Okay, then some people even complain of chest pain. They felt like am I getting any heart attack, or am I going to die, or this we call it a panic attack, right? So anxiety symptom is also very common, right? Other than mood symptom, anxiety symptom, yeah. So how do we prevent this, right? We don't want this. We know that just now we mentioned about multiple roles, okay? Multiple roles among women's life, okay? So how do we balance ourselves Time management is very important, right? But more, what is more important? Self-care. Okay, self-care is very important because we often prioritize. Some people tend to prioritize others' needs than compared to themselves. Okay, but why? Why is it ourselves not important? Our time not worth for ourselves, is it? No, this is a wrong concept. We should prioritize on ourselves before, you help yourself first before you can help other people. Okay, if you yourself do not have a strong mental mind, right, you're not having a good mental health, so how can you help people, right? So self-care is very important. Self-care is not about selfish or what, but prioritize yourself first before you can help others. All right, so when we talk about self-care, what is self-care? It is a very simple concept, right? Like for example, everyday, day-to-day life, you can actually allocate some time. For example, like 10 minutes, up to 30 minutes per day. If you can't afford like 30 minutes, even 10 minutes itself is good enough, right? So self-care. Okay, so what can we do? Not necessarily talk about spending money to do some luxury things like go shopping or spa, or not necessarily spending. It can be very simple, like as simple as a daily 10 minutes of mindful breathing, or what we call the meditation, right? This is good enough because every day we are so busy, so stressful with many things, so preoccupied with many things, right? Many noises inside our head and outside from the environment. So a 10 minutes of mindful breathing, the meditation can actually help us to provide a moment of silence to ourselves, okay, to bring us back to the awareness, to our internal voice, to know what shall we focus on or prioritize on, because we got so many things ongoing, isn't it? So a 10 minutes of mindful breathing is very helpful to help us to get back to ourselves. It's very easy to do, right? You just breathe in through your nose and then you try to hold your breath, and slowly you exhale out through mouth. Okay, breathe in through nose, hold, and then exhale out through the mouth. All right, just 10 minutes or 5 minutes in a comfortable position as you do, then it's okay, right? If you can't do 10 minutes, even 5 minutes also is good, right? So other than so-called mindful breathing or the meditation, if you don't like it, you don't think that you're a suitable person for meditation, you can go for exercise, right? We promote exercise. Why exercise? So many people promote exercise as a way of the stress management or the relaxation techniques. Okay, because exercise actually is very helpful. Through exercise, it helps to promote the production of the endorphin. Endorphin is the so-called happy hormones because it promotes the good, positive emotions of ourselves, right? Improve our moods. It helps with the sleep as well. It helps to reduce stress. Okay, exercise also helps to keep a good physical health for the person. So good for both physical and mental health. So exercise, not necessarily you have to do outdoor, even indoor also can, right? Some people, they don't like outdoor activities, so they prefer indoor, they go to gym. Okay, if some people they like outdoor, you go to outside, you go running, you go for a walk in the park, you go jog, right? So in contact with nature is also a very important point. In contact with nature, it also helps to promote the sense of well-being, right? Improve our sleep as well. Okay, so all these, it can be as simple as that for self-care, right? So of course, if some people they don't like this, they think that this is not the thing for me, you can find other methods, suitable methods for you to go for relaxation, to manage your stress, because day-to-day life you're so busy, have many stress is normal. It's just that how do you want to handle your stress, right? You have to find a way which is suitable for you to handle the stress. Like just now we mentioned about meditation, we mentioned about exercising, right? Physical exercise. So some people, they might think that it's not suitable for me, not my thing. So what should I do, right? Of course, you can find your own way. Some people, they like to, when they have problem, they feel stressed, they need some support from the family, okay, or their friends, good friends, right? So you can always, ventilate to your friends or someone that you can trust, okay, that you feel comfortable to talk to. So when you feel that, when you share with someone your problems, your feelings, or you felt like, being supported, being validated, about your feelings, even though they might not be able to help with your situation, okay, but being heard is very important because you feel supported in that way, right? So sharing with other people is one thing, right? Some people, they enjoy listening to music, some people, they enjoy reading, some people enjoy drawing, or even, some people, they don't like to share with other people, they tend to internalize it. But another way is they can write down. We ask them to write a mood diary, okay, to track their mood. There's another way as well, right? So we talk about all these self-care, the relaxation techniques, right? How about balanced diet? Balanced diet is also very important, right? Some people, when they stress, they tend to binge eating. They feel they don't. Some people, when they feel sad, they say that, okay, like snacks, sweet beverages, sweet foods, actually can help to improve their mood. To some extent, yeah, but it's not good for physical health, right? Because we actually promote a balanced diet rather than the sweet beverages and the snacks. Yeah. So remember, like Mediterranean diet, those the food that rich in antioxidant, fruits, vegetables are actually good for both physical health and also mental health. Because some studies say that the food that rich in antioxidants actually help to improve your mood, to improve your mood, to counter the depression, right? Okay, so balanced diet, physical exercises, right? Way how to improve your emotions, how to handle stress, right? The deep breathing technique. All those are the ways that you can use to help to manage your stress, right? Okay, so we talk about self-care, we talk about the stress management, right? Okay, how about how to improve mental resilience, right? Just now we mentioned about the resilience, the ability for someone to adapt when some adverse events occur. How do we adapt to that situation and to deal with it and to go through it, right? So this is very important because you need to ask yourself when something happens. You need to ask yourself, what am I doing? Is it helping me or harming me, right? Am I having the positive emotion or the negative emotion? Because when you identify that this is a negative emotion, we need to think, how do we change it into a positive emotion? A lot of people, they used to like suppress themselves when they face some difficulties, for example, sadness or anger. Then they feel like, no, I don't like to be in all these uncomfortable feelings, right? This is very difficult for me, right? So they tend to suppress themselves or they tend to just avoid. Okay, but this is not a way, right? Because the best way is you deal with it. Be in the situation, you acknowledge that, yeah, I'm not feeling sad, it's a very difficult period for me, okay? But you acknowledge it and you endure with it and go through it, then try to get over it. So with that, you gain the confidence, the self-confidence of you. You give yourself the self-confidence that you will be able to go through the difficulties. You can handle these difficulties, right? So you change the negative emotion to the positive emotion, right? So, and also you need to ask yourself, when something happens, how do you perceive that matters? Can I look it in another way, right? Is there any other perspective at how do I look at one way? Yeah. So change your perspective, change the way that how do you respond to it. Yeah. This will help to build the resilience towards to handle the difficulties in life, right? Okay, so we talk about resilience. So just now when we talk about all this is for ourselves, right? But what about our younger generation? Because women's mental health is not only about women, right? We mentioned that we go through, for women, go through different stages of life, right? And it all started during the puberty, right? From birth until puberty, adolescent years, then adulthood. That's the critical period to form our personality and build the resilience, actually, right? So as a woman, as a mother, right? So how do you prevent your next generation, your children, from going through, all these risks? How to reduce the risk of them getting mental illness? You have to provide a secure and a supportive family environment for them, right? So just now we mentioned about the inequalities of the treatment in terms of boys and girls, right? Some girls are not being favored, yeah. So this thing has to be changed in the family, yeah. Then we mentioned about they receive some discrimination and even some judgment, abuse, yeah. So we need to protect them from being abused. Okay, need to educate them on how to protect themselves, right? So how about coping skills? You need to help them to shape a good coping skill, positive coping skills, rather than the negative coping skills like self-harm, right? So from young, we need to teach them about all these coping skills, their problem-solving skills, yeah, communication skills. So provide a safe environment for them, make sure that they know that they are being heard, okay, when they have problem. So all these are very important because family is a secure base for the children. Okay, if they have a secure base, they have a strong family tie, okay, when they grow up, they will become more confident, they have a higher self-esteem, then the risk of them getting a mental illness will be much lesser compared to those having all those vulnerabilities. All right, so we need to teach them how to communicate with others, yeah. How about the coping skills? Okay, so that's about protecting our future generation, yeah. Not only about ourselves but also about our younger generation as well. Okay, so when we identified that we have all these possibilities of developing a mental illness, like all the signs and symptoms of depression, anxiety, that we mentioned, so what should we do, right? Of course, you have to know that help is always available. Okay, so some people, we live in the era of internet. A lot of people, they tend to Google. Okay, they go through all the symptoms of the mental illness, certain symptoms. Oh, so they do some self-screening online. Okay, that's good. All right. So if they think that, okay, I need possibly I need some help, right? So they can always, seek help from their friends, or if they don't want to go to the professional at first, right? So get some support, some advice from your friends and family. Okay, so other than a doctor, you can always see counselor, right? We have both a counselor in the private and also government setting. Okay, so other than counselor, right? If they think that you might need further help, okay, so it's either you'll be referred to the doctors, or you can also self-refer to the doctor as well, right? So we have not necessary you must see a psychiatry, okay, because some people, they might have some resistance to see a psychiatrist in the first place. Okay, they might go to their family doctor first. That's fine. Okay, our doctors out there, be it the primary care setting, in government setting, or the private sector, they are all trained, okay, to help to screen for all these mental health issues and also treat the mental health issues, so you can always go to them. Or if you feel like you need some help from the psychiatry department, you can always refer to us, right? So you go to the clinic to get the referral letter to be referred to the psychiatry department in the hospital. Okay, all this can be done. And even in the case of emergency, okay, can always go to the emergency department, okay, for emergency case only, right? For example, like acutely suicidal, or psychotic, or okay, emergency cases, then can go to emergency department. We will have our on-call team to stand by to assess, to help in those situations, right? So we talk about, okay, how to seek help, and then how about self-help, right? So self-help, because all these skills, not only treatment for mental illness is not only about medication, right? We need all those skills as well. Like you can always read on how to improve your skills, the problem solving skills, yeah, the communication skills, yeah, coping, how's your stress management, coping skills, all that. I mean, all these can be learned, okay, can be learned. Either you learn yourself, or you read some self-help apps online, or you can go through to seek help from our psychologists as well. We have the either counselor or clinical psychologist who can help with all these therapy, right? So remember, women mental health is not only about women, right? Not only about women themselves, but also about their future generation, and also about the community, right? Remember, there's no health without mental health. So please maintain a good physical health and mental health, all right? And remember, you're not alone. Help is always available, right? Okay, thank you.